This story really depresses me, in all honesty. It really makes me sad. It makes me despair. Not a lot of things make me despair. In spite of appearances, I'm actually a pretty positive guy. But this really makes me sad. All right, so Stu Studio found this. He's at Manhattan Institute. A lot of people grabbed the clip without giving him credit, so I want to give him a shout out. So this piece of video, he grabbed it from the DSA's own feed, and in the video you will see Daniel Goulden, a member of NYC DSA steering committee, speaking on a panel DSA just uploaded from last month's Socialist 2025 conference. Goulden worked on Zoran Mamdani's campaign, helped write the trans policy platform, and says he regularly meets with Zoran and his staff. All right, so let's hear it.
Literally attempting to do what conservatives... Zoran is literally attempting to do what conservatives say, we want to do, which is provide gender-affirming care to anyone who wants it for free, and we're going to ship people, we're going to fly people in and pay for their hotel rooms, and we're going to do all of the Fox News stuff. We're getting ideas from Fox News. I want to we'll do that. We're like that. We wrote the platform with him. The team was so happy to work with us on this, and now he's going to be mayor. New York City could provide trans health care for every trans person in the country who, can't afford it. And it would be a blip on our radar.
That really just made me sad to watch. I've talked about this. I don't get why now, of course, the DSA is this kind of Democratic Party sheepdog organization. But even people who would consider themselves radical leftists have been captured by this gender ideology. Now, at this point, it's getting harder and harder for me to understand it because I understand it with libs. It's a substitute for a political point of view. I don't get it with people who have an economic analysis, that they're too lazy to look at the evidence or too incentivized in aligning themselves with the right position, which again, I don't understand why you would continue to embrace that as the right position. So indeed, what he's saying, this is on Zoran's website, a private institution operating with a $250 million public subsidy should not have the ability to sell out young trans New Yorkers to the Trump administration. Yet that's exactly what happened when NYU Langone decided to stop providing gender-affirming care for trans youth. Translation: decided to stop doing experimental medicine with no evidence base on children, something that the vast majority of people agree with. Soon after, other private NYC hospitals also stopped providing necessary life-saving health care for trans youth. These decisions, now remember that phrase, life-saving. These decisions are in direct contradiction with New York state law. The Mamdani administration will protect gender-affirming care immediately by investing $65 million in public providers to provide gender-affirming care to New Yorkers who seek it, and will hold private entities abetting Trump's attacks to account. The Mamdani administration will budget $65 million in funding to explicitly support and expand access to gender-affirming care in NYC. It will direct $57 million to public hospitals, community clinics, federally qualified health centers, and nonprofits providing gender-affirming care. In the face of the Trump administration's proposed elimination of federal support for GAC and his threats to care for adults, this infusion will protect GAC access for both transgender youth and adults. Okay. So what kinds of problems involving healthcare costs could be addressed with that money? Well, Mamdani certainly speaks up for undocumented people and the assaults of ICE. 47% of undocumented people in New York City are uninsured. Now, of course, politically, that's kind of inviting attack, but you clearly don't care about that if you're going to back a policy like this. So, hey, man, why don't you put that into insuring the undocumented? Wouldn't that be a more reasonable use of these funds than, as the DSA person says, literally flying people to New York on principle in order to give them gender affirming care?
Not just the care, the hotel, the travel, the whole thing.
Yeah. 12.6% of legal non-citizens have no health insurance, 6.1% of naturalized citizens, and 4.8% of native-born citizens. So all of these people could be given health care with that money rather than to put it into some provocative culture war gesture. What about medical debt? About 4% of New York City consumers have medical debt. The statewide average is 6%. Central New York, it's 14%. But as in all areas, disparities exist in NYC as with the rest of the state, with communities of color and lower income communities experiencing higher rates of medical debt. So you claim to care a lot about those communities. They'd appreciate that. You know who actually put money into wiping out medical debt for New Yorkers? Eric Adams. Eric Adams did that. So why don't you do it? Why are you spending $65 million on this fringe issue that does not impact most people's lives? Even people in the activist space, when it's convenient for them, will say, this affects so few people. Why do you care so much about it? Well, that goes in the other direction too, doesn't it? And even if you do care about it, wouldn't you say these issues affect a lot more people? Like, would you say that issue is more important? Well, as you see in Mamdani's own wording, the way they get around that is by framing it as the most dire of issues. It's a matter of life and death. Steve Strangio, the ACLU lawyer who argued for this kind of care before the Supreme Court, was forced to concede that there is actually no evidence that this kind of care for youth prevents self-deletion. Let's hear that.
In every respect, but on page 195 of the Cass report, it says, there is no evidence that gender affirmative treatments reduce suicide.
What I think that is referring to is there is no evidence in the studies that.
I literally know a guy named Steve Strangio.
Oh.
His name, so my apologies, Chase Strangio.
Suicide.
What I think that is referring to is there is no evidence in the studies that this treatment reduces completed suicide. And the reason for that is completed suicide, thankfully and admittedly, is rare, and we're talking about a very small population of individuals with studies that don't necessarily have completed suicides within them. However, there are multiple studies, long-term longitudinal studies, that do show that there is a reduction in suicidality, which I think is a positive outcome to this treatment.
Let me ask a question about another issue.
Okay, so basically he danced around it he was forced to admit there are no studies that back up the idea that this prevents self-deletion. He says, well, there are studies that show that it prevents thinking about it, which the evidence for that is sketchy in and of itself. But this core claim, would you rather have a live son than a dead daughter, is based on nothing. It's based on absolutely fucking nothing. Now, you can go to a lot of different sources. There's been a lot of debunking of gender medicine. There was a case, we actually covered it a while back, where one of the strongest advocates for transgender care wouldn't release their own study because it debunked the idea that it's actually helpful in youth. It was specifically about that. So the Atlantic, if you want to read about a lot of those cases, the Atlantic put out an article that was good from a liberal who feels that the laws in red states banning youth transgender care are going too far, but feels that she's kind of forced to reluctantly support it because the medical industry can no longer be trusted in this area, but defaults to it's helpful for certain people. So you're not talking about somebody who's ideologically opposed to this, quite the opposite, who wrote the article. After England restricted the use of puberty blockers in 2020, the government asked an expert psychologist, Lewis Appleby, to investigate whether the self-deletion rate for patients at the country's youth gender clinic rose dramatically as a result. It did not. In fact, he did not find any increase in self-deletion at all, despite the lurid claims made online. Quote, "The way that this issue has been discussed on social media has been insensitive, distressing, and dangerous, and goes against guidance on safe reporting of self-deletion," Appleby reported. "One risk is that young people and their families will be terrified by predictions of self-deletion as inevitable without puberty blockers." Well, yes, that's the intention. When red state bans are discussed, you will also hear liberals say the conservative fears about the medical transition pathway are overwrought because all children get extensive personalized assessments before being prescribed blockers or hormones. This too is untrue. Although the official standards of care recommend thorough assessment over several months, many American clinics say they will prescribe blockers on a first visit. Can this misinformation bubble ever be burst? On the left, support for youth transition has been rolled together with other issues, such as police reform and climate activism, as a kind of super saver combo deal of correct opinions. The 33-year-old Democratic socialist Zoran Mamdani has made funding gender transition, including for minors, part of his pitch to be New York's mayor. But complicated issues deserve to be treated individually. You can criticize Israel, object to the militarization of America's police forces, and believe that climate change is real, and yet still not support irreversible, experimental, and unproven medical treatments for children. Exactly. It makes me feel like I'm taking crazy pills, that you even have to explain that to people. It is just amazing to me that at this late date, when it is so clear how discrediting this is. And hey, man, fine. If the facts and the science were on your side and you say, hey, I'm going to take a stand, I'm going to take a moral principled stand, even if society's against me, okay, I'd be right there with you, man. The science doesn't support it. And what's so crazy about this is you're talking about a population that on the whole, if you said to them in any other context, do you think the American medical industry is corrupt? Without hesitation, without even missing a beat, yes. Do you think the American medical industry, do you think the insurance companies, do you think the pharmaceutical companies overprescribe and prescribe treatments that are unnecessary to make money? Do you believe that it's a system of sick care rather than health care? Yes. Without hesitation. You say, okay, so Sweden, the first country to ever allow people to legally change their sex, has banned these treatments except in an experimental context. Same with Norway, same with France, same with England. Countries far to our left with, this is key, not-for-profit healthcare systems have all stopped this after looking at the evidence. Why do you think our singularly for-profit healthcare system won't let this go? Why do you think they continue to push this? Well, maybe we're more advanced. I literally had somebody say that to me in response to that. Well, maybe they're more advanced. They would never say that in any other context, that America is more morally and ideologically and philosophically advanced in such a manner than these far left European countries like Sweden. In this one area, man, that is what's just mind boggling to me about it. And when you do talk to these people who have an economic left critique, who embrace this, it is very much what she says there. It's just, it's the correct opinion to have. They haven't looked into it. When you tell them all these countries that have banned this in Europe, they don't know a fucking thing about it. They know nothing about it. They just adopt this point of view as the right point of view to have. Now, we talked about ops a lot in the City Sweeney thing. We've covered this from that angle. Michael Parenti, who we're going to see a little bit of video from, has written a lot about this, that this kind of shit was injected into the left exactly for this reason, to discredit the left, to make it very hard to build any kind of a working class movement with left economics by connecting it to deeply unpopular and deeply repulsive to most normal people cultural positions. That's the purpose of it. So I understand to my satisfaction how it got this way. The question to me is why so many people who should know better don't ask these questions. I don't get it. It is fucking depressing to me to see people, not just the DSA, not just the sheepdog DSA. You have a lot of genuinely radical post-duopoly leftists who will not let this shit go. They will not let it go. I don't understand it. I don't understand why nobody has the courage to do the research. Do the research. I'm not saying to disown a moral cause. Go do the research and then tell the fucking truth. Tell the truth. I don't get it. Now, the other thing you might have noticed looking at this, and you know this is not really like our issue. Jimmy gets more into this, but I agree with him generally on the liberal neurosis that drives them to still be obsessed with masks and hygiene. This is fucking 2025. How do you think that strikes most people when everybody there is wearing a mask? Why are they all wearing a mask? It was the policy that you had to wear a mask in 2025. Why? Policies and guidelines are subject to change. Attendees are required to wear a mask, and they get specific about the mask, N95 or K95, not even those little shitty ones you got at the bodega. You got to have the real one, over their mouth and nose while indoors at the conference. Masks will be provided for those who do not have a mask. Please note this requirement applies only to formal conference spaces and sessions. Attendees should be aware of the possibility that attendees will be unmasked elsewhere in the conference hotel or beyond. God forbid. Testing. Attendees are encouraged to test themselves for COVID prior to making their way to the conference. And then they want you, if you are going to be one of the speakers, so you're going to take a mask off, to get tested that day. They don't make it a requirement, but they strongly recommend it. Now, for normal people looking at this, you look like a fucking nutbag at this point, at this late date. And hey, man, it's not just that conference. When I was out in Seattle, I took pictures of this. The Leftist bookstore there, look at this. Masks required Sunday to Thursday. And then I guess they want some of the MAGA business, so you don't have to wear a mask on Friday and Saturday. But most of the week you have to wear a mask. This was in February. This is not 2021. I took these pictures in February when I was out there for the Worker Strike Back conference. Why? Why? This is, I've mentioned this before. This is a open mic poetry thing. You know, I do some readings. So I've looked for venues to do readings in. It's a poetry reading they do on Friday nights in Brooklyn. You see all the people sitting there? They're wearing masks. You have to wear a mask to go to this. Now, summer 2025, you have to wear a mask to go to this poetry reading. Now, a poetry reading doesn't necessarily tell you what their politics are, but I've been to enough poetry readings. I promise you, they are not to the right. They're not conservatives. Again, and I think it's connected. Why is the left overrun by very neurotic kind of people who, the perception, the way they would strike you, people who are not very physical, who are not very hands-on, who are not very capable, who are, man, you don't see any Duck Dynasty people at TSA, you know what I'm saying? Like, why does it attract people like this? Again, I think that's by design. I think that with the rise of the new left, um, they created a left that would be completely disconnected from the working class. So what does that result in? You get rid of all of the working class people, you drive them over to this kind of quasi-fascist movement. What do you have left on the left? You have a lot of overeducated, very neurotic kind of people, like the kind of left, and it's a vicious circle. Once you have a left that represents itself this way, it repulses people who are not this way and attracts more people who are that way. This is why I found the whole thing depressing. It wasn't just the trans stuff, which they will not let go of. It was the masks. It's just you look at this and you say, there is no real visible left in existence that can win over a majority of people at this point. Like that can feel very hopeless, because you look at that and you say, you can't even build on what's there. Like, you almost have to start a movement from scratch, from the ground up, because the left has been so overrun with ideas, with people, with the way it represents itself, that are just fucking repulsive to over 90% of people. Even if they're right on the economics, you're not going to win. You're not going to win with these people, man. Sydney Sweeney is going to beat these people hands down every fucking time. Now, somebody who understands that very well has written very extensively about this, in addition to Caleb Maupin. Caleb Maupin has written very well about this subject, how the left got this way, how that was very much intended to subvert the left as a threat to power. Here's Michael Parenti talking about, he went to a committee of correspondence meeting where a lot of it got caught up in who's more oppressed.
There about the rights of gays. And they said, oh,
go back a little bit.
And a guy got up from the floor, had a microphone on the floor, and he says, you have nothing in there about the rights of gays. And they said, oh yes, let's put something in there, rights of gays. And a woman got up and she said, you have nothing in there, it should be gays and lesbians. He said, right, I said, gays and lesbians. A guy gets up and he says, now transgender and transsexual hadn't yet quite come into vogue. That was a couple of years down the line. But he says, it should be gays, lesbians, and bisexuals. Because we bisexuals get discrimination from both communities sometimes. They say, oh, yes, they put gays, lesbians, bisexuals. And I was sitting there, and behind me was this old lefty trade union type of a guy, and he said, just loud enough for everybody to hear, he said, yeah, and how about putting something in there for the people who are too tired to have sex when they get home from work? And that, ladies and gentlemen, that's who I speak for, the people who are too tired to have sex when they get home from work, which by the way includes any number of gays, lesbians, bisexuals, African Americans, Asian Americans, Latinos, everybody else, in this very exploitative, oppressive society that we must continue to resist and rectify. Thank you very much.
Yeah, as always, the great Michael Parenti puts it in very understandable, very accessible terms, man. It's not about any particular group. It's about organizing based on class rather than organizing based on identity. But that's exactly what they didn't want, and that is why they infiltrated the left. with what I think started out just being operatives, diverting them into these kinds of culture war issues, driving the working class out, until finally you end up with a bunch of, mask wearing, very neurotic people who turn off most of the public and who are very prone to, in a very knee jerk way, adopting extreme cultural positions that they perceive as being progressive or being an extension of earlier rights movements, when really a lot of these positions are just designed to alienate the working class so that you're never able to extend beyond this group of people who in the summer of 2025 are still walking around with hand sanitizer and an N95 mask.
Yeah, so, I think when it comes to the DSA, I mean, look, they're a joke for a lot of reasons. And what I find so infuriating about that policy is that it draws a line through the working class, which is the first rule, of organizing, socialist organizing, is you don't draw lines between the working class. The line to draw is between the working class and the rich. So if your program is free healthcare for everybody, at that point, you would include gender affirming care in that program, right? You don't say free healthcare for everybody, but trans people have to pay for their own hormones, right?
I mean, not for youth, because you're talking about experimental medical treatment on children.
That's a point of regulation, and that's determining what the treatment is. That's a separate question, right? That's because then you into questions of informed consent. But I'm just saying, if you have a platform of free healthcare for everybody, you don't say free healthcare for everybody, but trans people have to pay out of pocket for whatever that care is. And like I said, that the question of what is that care, that's a separate question, right? But whatever the approved care is according to the regulations of the jurisdiction, you don't draw a line between trans people and everybody else, because then you are drawing a line through workers and saying, okay, we're going to have free healthcare for most people, except you can't do that, right? It has to be free healthcare for everybody. So Shama's platform is in conjunction with her campaign for Congress, Medicare for All in Seattle. Basically, do a citywide universal health care program, which, yes, would include coverage for gender affirming care. Again, what constitutes that? What is regulated? Isn't that, to me, that's a different question. The question of organizing is, how do you, if you're not campaigning for Medicare for All in New York, which Mamdani is not. That's not on his platform. He's not going to, we're going to make New York City free healthcare for everybody in New York City, right? That's not his platform. So if you're not advocating for free healthcare for everybody, but you're saying we're going to allot $65 million to make this a transgender sanctuary city where transgender people can come and get medical care for free, well, yes, of course, that then you are dividing workers, because the undocumented workers who have trouble getting health insurance are saying, well, wait a minute, why are you giving free care to trans people, but not me? What if you're going bad? What if you're drowning in medical debts and you're having a hard time getting relief? And they say, well, why are you going out of your way to provide free care?
Forget about undocumented, right? Native-born people here.
That's what I mean. That's what I said. Even anybody who is uninsured in New York are going to ask, okay, why are you making an exception and saying free health care for trans? Like, it has to be,
it's nuts.
Universality, and the organizing has to be class based. The first rule is you don't drive wedges through workers in either direction. I mean, people a lot of times mistake that for saying, well, okay, and this is why, when we interviewed Shama's campaign manager way back, when they went and they organized with those, I forget who they were, some workers who were on strike, they said, you can't immigrant bash on the line because immigrants are workers too, and we have immigrants in our organization, right? And so they said, okay. But, if you say, okay, we want high wages for us, but not for immigrants, well, that's the same thing. You're drawing a line between workers. You can't do that. You can't do that. And that's the first rule, I think, of any class-based organization. You have to keep the lines very clear, and it is class-based. So to single out one particular group within the working class and say, okay, you are going to get free health care, all these other workers are not, that's no good. If you were running on free health care for everybody in New York City, and that includes whatever gender care is approved within New York City, I would have no problem with that. But when you make it a point to single that out to the exclusion of everyone else's free health care, yeah, that's the absolute wrong way to organize. And how could an organization that calls itself a socialist organization not understand that? How? That screams infiltration to me, honestly. That seems like you're trying to fuck up. Because if you have any clue as to what it means to organize a working class movement, you know this is the absolute last thing you want to do.
Of course.
Is drive a cultural wedge through workers and say, we're going to give free health care to this small group of workers while leaving the others to fend for themselves
and bring them
debt.
in.
Right.
Bring them in
exactly.
from outside.
Yeah.
I think, and again, Michael Parenti is probably the best writer on this. Yeah, this was always an op. At this point, the op was so successful that I don't know that you need to infiltrate to do this. I bet you from talking to some of these numbnuts that the guy speaking there on the video, he believes that shit. Like he doesn't need a handler to say that. This is what's so because I've talked to people that I know are legit that will not let this shit go. That is how effective a psyop this has been. Even people with a legitimate Marxist class analysis will not shut the fuck up about this bullshit. I'm not going to lie. I watch that, and yeah, it's DSA, but you know what? It's not really any different from what I see with the more radical leftists. Like a bunch of people sitting there in fucking masks talking about the urgency of this very niche issue above all other things, as you point out, above much broader issues that affect everyone, including trans people. That's the left generally, man. That's not just DSA. That's the left generally, even the radical left, and it's depressing.
I mean, what I would say is, if you're advocating for universal health care, I think that's one thing. But if that's not on your platform, if you're not talking about bringing universal health care to the city, to me, that's what makes that especially damning, is that they're not even talking about giving free health care to everyone. To me, that's what that is. And, to me, it's a betrayal of class-based organizing, which how can a socialist organization not know better than that? Really, really pretty bad.
Well, because you're so far removed from a left that is organically connected to the working class that you wind up with this very academic vision of what leftism means. There was the Wall Street Journal did an article about it, obviously from a different perspective than I have, but they weren't wrong. I'm pretty sure this was the Wall Street Journal did an article. We've said this ourselves. The reason that all of a sudden you're getting all of this support from college-educated white PMCs for socialism and Mamdani is not because they all of a sudden got woke, I mean real woke in the original sense of the term. It's because the system's not working for them anymore.
Right.
That's why.
Of course.
So
Yeah.
You're winding up with a left or a socialism that's made up of the children of privilege, and those people in the end just don't have the kind of class perspective that would lead them not to present themselves this way.
Yeah, that is largely true, especially among DSA. I think it's especially true that you would single that out. Because, look, there are people who are culturally more liberal on this issue, that still, I think, know not to drive a wedge through workers in that way. Like, whatever. Like, I personally don't really care what your opinion is on the issue, as long as you're not using it as a wedge, right? Like, as long as you're not using it as a wedge between workers, to me,
you're using it as a wedge as soon as you make that central to your platform. Especially, right. I mean, he's not just saying gender affirming care; he's singling out youth, which again, if you present yourself in that way, you are not going to be able to build a working class coalition. And again, if you were right on the science, I'd say, all right, I mean, we could talk about the politics of it, but you're on the side of the angels. The idea that you don't have the science, but the signaling of it is so irresistible to you that you don't really care about that. It's fucking depressing, man. Like, how can you argue, well, the left are the people who are really dealing with facts and not propaganda, and then go out there and say things like that, man? It's sad. It's very sad.
Yeah, I mean, like I said, from my perspective, the sin of that is using it as a wedge to drive between workers. To me, that's where that really fails. That being said, he'll still win. He'll still win in New York. His polls are still pretty good.
In all
So he'll still win.
likelihood,
Yeah.
because it's New York.
Yeah, he'll be okay in that.
Because
in that
it's New York, and because this is something. I mean, we'll see how that plays out. Sliwa can't win, like he's not in any position to win. And how can people who are vying for Democrat voters in New York City, specifically in New York City, speak against that? So he's not really going to be getting any attacks on it, except from Fox News, which he doesn't have those people anyway.
Sure. No, so yeah, he should still win, and I would still vote for him if I lived in New York City. But that just shows a real ineptitude in my opinion.
It's just I see that, and you want to grow beyond New York City. You want to grow beyond these meccas, these blue meccas, and you see that, you're like, it's never getting out of the 5 boroughs with that shit.
Please clap.